Feven is an LPN with a history in home care, practical nursing, vocational nursing. She's now with Miracle Home Care here in Calgary. And if you're like me, you may not have heard of Miracle Home Care. It's a reliable home care provider. They have a goal to provide a better care option for loved ones who want to remain in their home or stay close to family as they age in place. Their services include companionship, personal care, nursing care, and specialty care. I don't know about you, but I'm ready to learn more from Feven.
So before I go into my presentation, I would like to introduce myself first. My name is Feven Gebregiorgis. I was born and raised in East Africa, and I left the country, my teenagers, in 2000, May 2000. So ever since I've been out of the country, and the last 20 years I've been here in Canada, both in Ontario and Alberta. I was trained my nursing in Hamilton, Ontario. And it's been more than 15 years since I've been an LPN. Mainly my experience is in the geriatric, which is the seniors, but I've had all the experience throughout the categories except for children. Today, I would like to present to you Miracle Home Care. I am the founder and director of care, and I am still working as a practical nurse in one of the nursing homes in Southeast. Like I said, I'm a family-oriented mother and nurse, and now an entrepreneur. They graduated from McMaster, Mohawk McMaster in Hamilton, Ontario, over 15 years of experience. And I also specialize in foot care, advanced foot care, as well as now I'm transitioning into wound care as well. And I speak more than 3 languages. So who we are. When we create Miracle Home Care, it was not just to deliver one of the best care, but it's also a calling for me. My nursing is mainly with seniors, and seniors means our grandparents, our parents that are now in need of our help. It could be in dementia, Alzheimer's, it could be a respite care, it could be after surgery, or after fall, any kind of help. Even though Miracle Home Care is mainly for seniors, our care is throughout all age groups. So it could be adults, children with special needs, and seniors with all kind of care as well. So a little bit about our company. It's a reliable home care provider. It's focused on improving the lives of each individual and family we serve. Our goal is to provide a better care option for loved ones who want to remain in their home or stay close to their family as they age in place, deal with their disability or recover from their health condition. We want our clients to achieve their full potential in living their day-to-day life by receiving the right care that's tailored to their unique needs and preferences. Nowadays, a lot of younger generations are in need of medical help because of so many things. It could be medical or non-medical. One of the non-medical that we seem to brush off as a society is mental health. A person can look very perfect from outside. They are, they're able to walk and eat and talk, but what they're dealing deep inside is something that we cannot really ignore it yet. We seem to be brushing it. And for your surprise, a lot of younger generations are now in need of mental health support to the point where they can't even take care of themselves. And there is a lot of things that's in effect for it. First is the parents that are looking after their children. They are seniors, they need help, but they're ending up taking care of their younger children. We're talking about children in their 40s and 50s, and parents could be in their 70s and 80s. This is one of our missions and vision statements, to provide care service tailored to the needs and conditions of our clients. We aim to be a reliable partner for families who request support in caring for their loved ones with special needs. This is some of our services. We provide nursing care, Alzheimer's or dementia care, post-op or post-surgery, palliative care, respite or short-term care. We are 24-hour medical or non-medical care, compassionate, advanced food care, transportation for people who cannot be able to drive. We give them the transportation service from to their house, running errands, shoppings, medical or non-medical appointments, light housekeeping and maintenance, and as well as special need care. Those are some of the services that our company is providing.
Did you know that the aged ones are having a hard time living alone at home? According to research and findings, 90% of aged ones need someone to lean on for rejuvenation and activeness. And that's what we do at Miracle Home Care. At Miracle Home Care, our mission is to provide home care services tailored to the needs and conditions of our clients. We aim to be a reliable partner for families who require support in caring for their loved ones with special needs. When it comes to providing top-notch professional home care services such as companionship, personal care, nursing care, special care, and housekeeping, rest assured you are getting the highest value and satisfaction without compromise. Ready to have a personalized plan of care tailored to your loved one's needs? Call our team of home care providers today at 403-991-9857. To learn more, visit www.miraclehomecare.ca or send a mail at info@miraclehomecare.ca.
Why do we need home care? So last time I was at one of the Kirby Center presentation, and a lot of people were coming to me and asking me that, why do we need home care? Why do I need it? Like, I can do this and I can do that. There is several things to it. And as a nurse of 15 years experience, mainly in the senior sector, I've seen and witnessed a lot of burnouts. So her husband or his wife is dealing with some sort of sickness. It could be any sort of cancer, any kind of mental illness. It could be Crohn's disease, a fall, unexpected fall. They slide or miss one step and there they go. They fall, they have a surgery, and then before they go to rehab, they're not able to go back to their normal routine. And what happened is that I understand, and all of the other home care providers understand the burden of the caregiver, the care provider. That means most of the time it's going to be the spouse or the person that they're living with. And they now have to be taking care of this person and dealing with the day-to-day life. And most of the time what happens is the stress will kick in and the care provider will fall before you know it. You now have to take care of two people instead of just one person. So this is why we advertise, and I personally try to communicate with people, especially at the workplace, that they have, take a day off. If your loved one is in one of the care facilities, you feel guilty for leaving them there. It could be your parents, it could be your siblings, or your spouse for that matter. And you feel unease, or you don't feel right leaving your loved one there and having your meal at home. And they're coming every single day. And whether you believe it or not, the stress will kill them before their loved ones. The stress will put them down before their loved ones. And if you don't take care of yourself, if you cannot put yourself up in the first place, you cannot take care of anybody else. And this, we see it even in the younger generation, like myself. We're mothers. I'm a mother of two boys, and I'm also a nurse, and I'm an entrepreneur, and I'm stretched to every single corner. So unless I have someone to give me a break, here is the kids, let me have a cup of tea or a day off. Of course, as a mother of young children, I can't have a day off, but I can have, I can have a cup of coffee for 30 minutes, uninterrupted coffee, right? So every morning, it's very important for me to have my coffee uninterrupted. Or it could be at night. Sometimes they are up early, and at nighttime, people are going to bed, and I wanted to have a book to read. And for seniors, I always say that, have a day off, please. I will take care of them. Have a day off. We have a daughter that was coming every single day. And finally, she was just tired and feeling guilty of not being able to come. And I say to her, I promise you, I will stay here until past my time, just to make sure that your mom has eaten and she drank. I can't force her. I can't just, let her to swallow if she doesn't want to, but I make sure. And the facility I'm so grateful that I work for are so good in taking care of the residents. So it was a rejuvenating, like it was a refreshing for her to come the next day. She took only one. Actually, she came in the morning and she took an afternoon off. And she told me the whole list of things that we did. So the home care that we're talking about is not to give your loved one away. It's more so to give yourself a break. It's to give yourself a little bit of breathe and having something to do that you love and enjoy for your soul, for your body. And as you take a break, before it's too late, once a person had a fall, it's gone. It's already too late. Once the person is sick, it's too late. Before it's too late, at least once a week, twice a week, whatever that you can be able to manage. It's so strongly advisable that people are taking a break from the responsibility that they have it, or from having to wear down, even taking care of the whole lot of work, whether it's at home or for their health. So what can be done? Always ask for help. Whatever that is that you needed, ask, starting from the people that are surrounding you. Ask for resources that you can access. So in this group, I can see that you guys are supporting each other. You're having shoulder to shoulder to make sure that, you've got that person to talk to lean to communicate and ask about the resources that's out there, which is the most important thing in life, I think, for any age group. So always ask, reach out to community supports. It could be your neighborhood or a group like this, or it could be a church or any organization that you communicate with. Ask for any kind of medical or non-medical support. And then most of the time, for a person who's not feeling well, who's not doing well, obviously the doctor is going to be involved. With it comes the social workers, the case managers from Alberta Health Service. Usually they get involved and they help with the financial burden or with any kind of support that's needed for the person at home. So ask them. Some of them, they might give you one direction, but they might know of more information. So for example, a social worker can help you how you can navigate about your social life. If you're stuck with a person who's looking after a dementia spouse, what can they do? Where can they go? Where can they start? It is the whole broad information that's out there. So you can start from the case manager or the social worker, because they will deal with financial, they will deal with different interdisciplinary team that they can help you with. So always ask, reach out for the people that you think of, starting from the medical doctors. They have a lot of resources and informations. Ask how HS and other benefit company can help, and get home care provider even for a short period of time. One of my clients, she wanted to travel. That was last year, and she didn't know. And her mom was at one of the Care West facility, I believe, and she wanted to go for travel for 2 weeks. She has home care, just 2 hours a day, and that gave her a support to make sure that mom is not alone, because her mom enjoyed the walk that they had outside all the time. And she had that to make sure for 2 weeks that she's going to be away. And she has all the layouts, all the informations if it's needed, to start with. The mother is in seniors facility. So just even for short period of time. And another person we met was, he wants to have some sort of medical treatment. And after that, he was living by himself. He was a younger man. He wants someone to look after him, to make sure that nothing is happening during that recovery time. So it doesn't have to be a long term, doesn't have to be all the time. If it's needed, it's out there. But even for a short period of time, to give yourself and your loved one a break, seek for help and reach out for home care providers. What's the difference our company from the others is first, the first 15 to 30 minutes is free consultation. So what we do is that it's over the phone and we'll say, do you need a home care or are you okay? Or how many hours do you need? Do you need a nurse? Do you need a healthcare provider? Healthcare aide. This is what we determine. And the first assessment is always done by LPN or RN. It's always 24/7 call access. The personal care plan is one care plan is not suitable for everybody. So whoever needs help, they have specifically, we create a specific care plan designed for that individual. It can't be one for all generated because everybody's need is different, obviously. We also have an app to indicate who is coming. So if I'm going to send a care provider to Mr. Smith, who is coming to Mr. Smith? At what time? What kind of care are they going to provide? Sometimes what happens is that they might need a nurse as well as a healthcare aide. The nurse is to give the medication to make sure all the medical part is covered. The healthcare aide is for the rest of the care. So bathing, dressing, it could be light housekeeping or meal preparation and whatnot. So who is coming at what time? They will have the app to know and to determine that if that person is coming at the specific time that they are scheduled for. So somebody is scheduled for 8 o'clock. We will be aware of it in the app as well because the care providers will download in their app. So when they log in, it will tell us that from where are they logging in? Are they logging in from that specific address or are they 5 minutes and 10 minutes away? So that we'll be able to trace it. And the other thing is that no one is just coming in and knocking at the door. Hello, my name is Feven, I'm a care provider, right? We have to make sure that because whoever is coming to our house, it's very important. Like myself, I want to know who is coming to my house. If not, you'll be knocking outside all day. I won't open the door. I'd be scared. Yeah, it's very important. And we know what's going on with this world. So we want to make sure that whoever is coming, they are supposed to be dressed in their scrub. I work in different home care companies and I'm pretty keen about it. They have to dress properly for the care that they're providing. So they will be wearing scrubs and they have to have a visible name tag and respectful approach and communication for that matter. AHS has a way to directly bill to the care providers as well as support the clients. So our company is registered with AHS and Blue Cross and other insurance providers. When they deal with us, when they agree to continue with Miracle Home Care, we'll make sure that they will have that direct billing without the stress of communicating with our clients. And we make sure that our staff are fully trained in ongoing training quarterly or as needed. So the next step that we're working is I'm personally trying to reach some doctors, trying to communicate with them instead of just waiting for God knows how long to see a doctor, if we can have over the phone. We have some doctors that agreed, but for some reason stepped back. Just to have, it might not be every day whenever we needed them, but at least once a week that they give us designated, we can communicate with our doctor to make sure that if the client needs to see a doctor for emergency purpose or to talk about something that's bothering them, and instead of just waiting for their family doctor, or it could be their family doctor if they can be visible via Zoom meeting or just over the phone. And always be the voice for the voiceless. That is one of my goal and my calling into nursing. Nursing is a career. It's a beautiful career. And it's a calling for majority of us to be there for those who are in need of help. Someone might not understand who my name is, might not remember where I came or what I did for them. But I can assure you, I've held so many seniors on their last day looking at me saying, thank you. And no money can pay me that feeling. And no money can tell you the amount of punch and kick and swearing, the amount of, throwing the pills and whatnot, more than that moment, someone holding your hand saying that thank you for the service, right? So this is one of the goals for Miracle Home Care as well, to be the advocate, to be the voice for those who are in need. It's not always about the money, right? It has to be also about the humanity that goes along with it. So thank you for your time. If you have any question. Yes.
Do you offer services in the Calgary area or the province?
Right now we are in Calgary.
Only
In Calgary for now, yeah. Calgary and surrounding areas.
Are you connected to Alberta Health? Like, do they use your company all the time for home care?
Not all the time. So we are one of the companies that is registered in the Alberta Health Service. So Alberta Health Service has a special contract with certain care providers. But if you prefer a personal care provider, then we are one of the list in the group of Alberta Health Service.
Okay.
Yes.
I left a brochure up there with client-directed care information, so if people are interested in that.
For sure. That's a good idea.
then it's some client asks you for a service
Sorry?
today. If you get a call for a service today,
Mhm.
when will be your answer? Tomorrow will you be answering?
Very good question. We will answer as soon as possible. So our call is 24/7. I am the director of care for the company. I am the one who I usually have the phone for. So we'll answer as soon as possible. We try, our working hours is between 8 to 5, but sometimes we get a call at 10 at night. If that person is a new client, we usually call them the next day, the next business day. If that person is an actual client that we have it could be an emergency. So we have to answer as soon as possible, immediately, pretty much.
Then you answer emergencies.
Yes,
Okay.
that's very important, yeah. Yes,
And you are connected with insurance, because a lot of all these, old people don't have all that excess money to start hiring somebody like yourself.
that's correct. So we are registered with Alberta Health Service on their file. We are also registered with Blue Cross and other insurance companies. Sometimes what happens is that even Alberta Health Service will charge you a certain amount based on the client's needs. So someone who has a surgery versus someone who is not feeling well and needed recovery doesn't have enough hours. So, but they have a limited hours. They do the assessment. The case manager is the one who does the assessment, and they'll tell you, okay, this many hours for you. And they will give you the actual home providers that they deal with. Or if you don't like that service or whatever the case might be, you can have a private home care providers, which is like Miracle Home Care. In that case, Alberta Health Service will cover a certain amount. And then if there is any differential, I don't exactly remember, I think it's 20 to 22, something like that. And then if there is a difference in it, and then you'll either have to ask your insurance company, or you have to pay for yourself.
You try and cover it as best you can.
Absolutely, absolutely. Nowadays, not only for seniors, for everybody, it has to be a reasonable price, right? And it's not something and that's why I'm trying to advocate and try to explain as much as possible. Yes, we don't have that much money reserved to pay and to cover for all our needs, but at the same time, in the long term, do you want to end up in a facility holding, waiting for someone to help you out? Or do you want to juggle in between your expenses for someone to come and help you? Yes, there is no money, but we're talking about a live person's health. So I try to mention this as much as possible. For home care, usually the client are the one who makes the decision how many hours a day or how many hours in a week that they need it, right? But usually Alberta Health Service helps as well as Alberta Blue Cross and Alberta Health Service and the medical doctors as well. They are pretty supportive in this and they help with that. Yes.
Can you give us an example of the costs? Now, I realize it's gonna base on what kind of, how much care, but say from something quite basic to something, much more intrusive.
So I will give you two similar examples. A lady who is at home, she doesn't need that much. Maybe she wants me to warm a cup of coffee or tea and talk with her, that sort of things. Another lady is in a facility, it could be the same age and whatnot. We don't charge them the same because the lady at home will need more care, more supervision, since the care provider is by herself in there. Within that frame time that we are, it could be 2 hours, it could be whatever, 3 hours. So that's the different payments. And this lady, she is in a care facility. So basically I'm sitting with her and talking to her or probably reading a book or something. So the charges are not the same, but it's also individualized. So if I answer your question, it cannot be a one-time starting from this kind of charge that we have.
If I may, David, I think the interest is knowing how many bucks that case of
Yes,
spending 3 hours with a little old lady twice a week is.
we charge per hour.
Yes.
Um, per hour. So I will just give you a rough example, 28 to 30.
Yeah.
So 28 to 30 an hour is what we charge. But again, 28 for one person who needs a lot of care versus 28 who doesn't need any care.
Yeah.
That's where we work in, right? And then, like I said, Alberta Health Service will kick in, and other insurance providers or other senior support will kick in to help with the financial burden that they have it.
There's a question in chat too. Do you provide care to Alzheimer patients where the partner needs help and a break?
Yes, absolutely. We do. That's one of our specialty. And I can't emphasize enough for care providers, or sorry, I should say, the family that are looking after Alzheimer's or dementia residents. I cannot emphasize the need for care, for home care provider. It is extremely important. What happened is that we've seen a lot of people, most of the time, the male or the father is the one who has dementia, and then his wife is taking care of him. And majority of the time, they don't know what's happening, so they became aggressive and hitting their wife. They are a lovely, lovely husband, supportive husband, but all of a sudden, I remember a lady told me that he grabbed her and threw her over the car. And and she's a tiny lady, and I nearly had a heart attack just to hear about it. He was finally in the wheelchair in the facility that I was in, but yeah, that's most important thing, especially for couple or for a person who is dealing with Alzheimer's and dementia. Even the starting part of it is extremely important to have those layout from early stage.
Do you help people who are considering MAID?
No, we don't. That's a special treatment. Until now, from my understanding, is that medical doctors are the one who's doing it.
You charge per hour, you said. They, for example, for a day, is there a minimum of hours that you require?
Yes.
What is the minimum?
Our company requires minimum of 2 hours per day.
Okay.
And then the other thing is that we try as much as possible, unless it's a medical emergency, for cancellation before 24 hours. So that way we don't charge the clients, because we will be able to inform our staff that Mr. Smith is not at home, you don't have to go. Yes.
Is there a difference in the charge if the home care is being done by a nurse versus just a home care person?
Absolutely. So as a nurse, when I come to your place, it has to be a medical need. Most of the home care providers is, if you're at home and you need a medical assistant, majority of the time, the pharmacy will send you in a bubble pack. So our healthcare providers are trained well to know that today is Wednesday, and for 2000, which is the bedtime medication, is in this bubble pack. So they will be able to pop it and to give it to you, make sure you swallow it. Versus when a nurse is coming, that's usually for catheterization or wound care or injectable medications. So yes, there is a difference.
And what is the breakdown between, like you talked about, RNs and LPNs? Do you have a breakdown between how many LPNs versus RNs?
RNs, we have one. And mostly she does is the paperwork, any kind of challenge and complaints, more so the management part of it. And I'm part of that group as well, so I deal with it, but usually with the RN comes their education and level of skills that comes within their education background, so they deal with it. So it's mostly with the administration and communication with the clients or the family members, versus the LPNs, they actually do the assessment as much as the RNs do. If the LPN is not present, then the RN can go do the assessment, but the LPN is the one who usually does the assessment, who does the medication needed, or whatever other kind of care that's needed in the community. Yes.
Have you done any work with Veterans Affairs?
Yes. Yes. Not with Miracle Home Care, but as an advanced food care provider, I was dealing with one of our clients in a different facility. He was already living in a facility, and I was going there to take care of his tolls. And I will send the receipt and whatnot. He already gave me his, I had the access, his number and whatnot, and I submitted, and they will deposit the charge. Any other?
Well done.
Thank you, thank you.
You can take brochure or business card, we don't need.
Yeah, there's additional information
Yeah.
here. And I guess what it boils down to is just like the airlines, when they're telling you to put on your oxygen mask first before helping somebody else. When you're looking at home care, make sure that the caregiver's looked after first before trying to help somebody else, because you got to be healthy to look after people. So excellent information. Thank you so much. You're a busy person, and we really appreciate you making time to share your knowledge with us. And like Feven said, there's brochures here. I was also on the website, and your website has some great information on the different types of services that are provided. So again, well done. We like it.